If you have insulin-treated diabetes, we should talk about hypoglycemia. Hypoglycemia is when your blood sugar falls too low. Some of the most common signs, and usually the first symptoms of hypoglycemia, are shaking, racing heart, sweating, anxiety, and hunger. To understand why these symptoms occur, we have to talk about your liver. There are two ways your body gets the sugar it needs for energy. 1. You eat foods that contain carbohydrate. 2. Your liver makes sugar. When your blood sugar falls too low, your body releases hormones like glucagon and epinephrine, which is also known as adrenaline. Glucagon and epinephrine tell your liver to release the sugar it has stored and to start making new sugar. You also release epinephrine or adrenaline during stressful or scary situations. So that's why some of the early symptoms of hypoglycemia, like sweats, a racing heart, and anxiety, are similar to how you would feel if you were being chased by a bear. The second type of symptoms happen when your blood sugar falls low enough that your brain is no longer getting enough sugar for fuel. These later symptoms might include difficulty concentrating, confusion, weakness, vision changes, and difficulty speaking. What causes hypoglycemia? You can think about your blood sugar as a scale. On one side, you have carbohydrate, bringing your blood sugar up, and on the other side, you have things like insulin, exercise, or alcohol, bringing your blood sugar down. If the scale is tipped too much in one direction, your sugar will be too high. And if it is tipped too much in the opposite direction, your sugar will be too low. So how can you avoid hypoglycemia? Well, you need to balance the scale. For example, you need to match the amount of insulin you are taking with the amount of carbohydrate you are eating. Or if you are exercising, you either need to eat more carbohydrate or take less insulin. What should you do if you have symptoms of hypoglycemia? Test your blood sugar to see if it is low. If it is low, consume a source of fast-acting sugar, like sugar, juice, regular pop, or dextrose tablets. Most people need around 15 grams of glucose to treat mild or moderate hypoglycemia. In about 15 minutes, check to make sure your blood sugar has gone back up. If it hasn't, then take another 15 grams of glucose. If you are not planning to eat within the next hour, have a starchy snack, like 3 plain cookies, crackers and cheese, or an apple granola bar. Hypoglycemia is likely to happen sometimes when you have insulin-treated diabetes. Try to plan ahead to prevent it. And just in case, carry a fast-acting sugar with you to treat it if it does happen. Always take the symptoms of hypoglycemia seriously. If your blood sugar gets very low, it can cause you to pass out or have a seizure, and it can even be fatal. If you have more than 2 or 3 low blood sugars in a week, if you have a low sugar that needs the help of someone else, or if you stop feeling the symptoms of low blood sugar, talk to your diabetes team. They'll help you with your diabetes management so that you can continue to do the things you enjoy.